All right, so my name's Erin. I'm here to talk again today about nerve glides and just different types of nerve entrapment. So all of our bodies are made up of muscles, bones, but then also nerves. So the nerves are what connects, obviously, our brain signaling to our individual muscles and also our organs to help them work and communicate together. So when our nerves are basically in our body and once we're born, they grow only until about the end of puberty. So once you finish growing, your nerves finish growing with you. So they're kind of at their maximum height, or I guess maximum length at that point. So our nerves are a lot different than our muscles in the sense that even though they are throughout our whole body, they connect everything, they don't really have much tensile or stretchability, if you want to say, or ability to stretch like our muscles do. So our muscles can tug, they can contract, and they can really stretch, but our nerves don't really have that ability, which is why they can get injured in certain ways, or as we call nerve entrapment, because there can be some pressure or something that develops along the nerve that then creates irritation and any sort of referral pattern. So a referral pattern, which those can come from muscles, it can come from nerves, it can come from joint irritation, but when we're talking about nerves, you can have something that's pinching or closing down around a nerve, which will then cause symptoms usually down a limb. It can be in the arms, it can be in the legs, you can even have some up into your head and neck. But what I'm going to talk about today is mostly on some of the upper extremity or the arm nerve glides, as well as some into the leg for the low back. So again, when I was talking about the nerves, they don't really stretch, but they glide back and forth. So that's why when we give exercises to patients, we call them nerve glides or nerve flossing. So if you imagine floss, like dental floss you would use in your teeth, is when you pull it out of the casing, it kind of has a little bit of, it doesn't stretch, but you feel a little give to it, but it's still a sturdy piece of material. So I'm just going to use this TheraBand just to kind of demonstrate a nerve in your arm. So if I have a nerve coming out of my neck and it comes down into my hand here, so if I take my hand and I stretch it out all the way and bend my wrist, you can see how the band gets tighter. And then as I bend my elbow in, it gets looser. So in certain positions, if you had, this would be along our median nerve, if you had median nerve entrapment, if I went to go reach for something like this with my hand down, I could potentially have some numbness, tingling, or even some burning type sensations that would come along the hand, mostly along the thumb, my first finger, middle finger, and then part of your ring finger. But the thing that's interesting about the nerve glides is it can be entrapment up at the neck where the nerve comes out, but you can also have some closing along muscles that follow that path. So if you put your dental floss down on a piece of paper and you maybe put a weight or something to block it along multiple pieces, you can see how that little band of floss gets cinched up. And that's, again, how our nerves can work, where you can have tightness along any piece of it, which will then irritate the nerve and then cause some of those symptoms down the arm. So let's say you do have some numbness, tingling that comes on into your hand, maybe with reaching for items just throughout the day, maybe working at a desk, and you have those symptoms, again, kind of into your thumb, your first finger, middle finger, or even part of your ring finger. You can do some nerve glides at home that can help alleviate those symptoms. So I call this one holding a pizza and dropping a pizza. So you're going to hold your pizza with your hand completely, or your wrist extended, and then from here, you're going to take your elbow and you're going to straighten it out and then pull it back in. So I actually have some nerve tension. So for me, I can bring my hand to about here, and then I actually start to feel a little bit of tingling sensation down into my first finger and my thumb. So that's where I stop. In theory, you should be able to straighten your elbow all the way, but that's something that you can work into in time. As I do nerve glides maybe during the day or at the end of a work day after it's just been a long day of working on my computer, working with patients, that I maybe can only bring my hand to here. So this is something where you don't want to push into pain. Like sometimes stretching, you're like, oh, this hurts so good. Me personally, and this might not be the same for everybody, I don't necessarily think nerve glides feel that way, as they kind of feel a little achy. You feel that numbness or tingling come on, which is not necessarily a fun sensation. So I tell people, do not push into that pain, because all it's going to do is aggravate the nerve a little bit more, which then will only continue to spread more inflammation in your body and then aggravate the tissues that do surround that nerve. So from here, you'll notice that as you do it more, that your range of motion will get more. Or you'll get more range of motion, hopefully, again, with that less numbness, tingling, pain as you go more. So now you can see my range of motion gets just a little bit more each time. And then if you do choose to include a cervical portion where maybe you have some neck pain that is incorporated with some of the arm symptoms, you can modify your head position to, again, kind of give a little bit of slack or add a little tension onto the nerve, and that you're truly moving the entire nerve from start to finish. So again, I'll kind of use my little TheraBand here. So if I put it all the way up at my neck and up at my hand, so if I stretch my hand out, you see the stretch, but if I let my head go, then it takes tension away. So here I'm able to get my hand all the way down without that numbness tingling. And then if I were to release it, then I can take my head and go the opposite direction. So now I'm opening the area where the nerve comes out of my neck. Now I'm closing it and then sliding it down towards my hands. So basically, it's just like a game of tug of war. It's just happening throughout the entire time. As people do get further along in their therapy, you can do certain modifications to that to really increase the tension along the nerve. So in time, you could, if you got your hand all the way out, you could then advance turning your head the opposite way. So now that creates a lot of tension. That's something that I'm not quite ready to do this early in the morning because I'm a little stiff, but as I got through the day, sometimes by the end of the day, I can kind of increase that tension or that stretch or the glide along the nerve. So that's a median nerve glide. If you are a person that sleeps at night kind of hugging your hands in, or you're resting your forearms on a desk, and you will intermittently feel some tingling down into your part of your ring finger and then also into your pinky finger, you could have more of ulnar nerve entrapment or ulnar nerve irritation. So since I kind of already explained the anatomy of nerves, I'm just going to show you the nerve glide for this one. So if you were a kid and you ever did this kind of an activity with your hands, that's kind of the motion we're going for with your hands. So you're going to bring your arm up in the same position out to the side, and then you're going to pull your hand towards your face. If you really wanted to do that, you could if you wanted to have some fun with it, but you're really trying to put the palm of your hand up to your face. So same thing again, you're just going to rock back and forth, but you're not really going to push into the pain of that numbness and tingling sensation. The first one I always say is a test, like you're putting your foot in the water before you jump in the pool to see what the temperature of the water is like. That's exactly what you're doing with these, is you're not trying to push past or into the numbness and tingling, just to, and then you modify your range of motion based off of that. So I generally don't talk about radial nerve glide, so I'm going to skip that one for now. It's just not as common, but we can address it later if needed. So I'm going to go over one more nerve glide just for the lumbar and the low back region. So if you are having symptoms down the back of the leg, so now if you were to picture a string going from the back of my head all the way down my body, down to the bottom of my toes, I can take my hands and then I'm going to put them behind my back. I'm going to slouch my posture. As long as that does not increase your symptoms, you want to slouch your posture. And then from here, I'm going to take my leg and I'm just going to lift it up until I feel a little bit of a stretch down the back and then lower down. So again, we're picturing that string from the back of my head all the way down to the bottom of my toes, so down the back of my leg to the bottom of my toes, where that is kind of the extreme of the stretch, is if I'm looking down and I'm slouching my back and lifting my leg all the way straight and pulling my toes up, that's really putting a lot of tension along the nerve. So depending on you and your anatomy and possibly where your pain is at doing the stretch, you can modify and again take some of the tension off. So if you were to remove your hands from behind your back, that would take some tension off the nerve. So you can lower down and lift up, and now I don't feel any stretch, so it's taken almost the complete stretch out of it. Or you could then take the foot piece out of it. So I could put my hands behind my back if that didn't seem to bother me too much. I can slouch my back down and go and lift my foot up, but with my toe pointed or plantar flexed away, like you're putting your foot on a gas pedal. So now from there, again, I really don't feel much of a stretch, but if you have some sciatic nerve irritation, maybe piriformis syndrome, some low back issues, moving that nerve back and forth without irritation can just let that one part of the nerve that's kind of pinched down or aggravated, it gives it a chance to just take a good deep breath because it's not feeling that same tension or that same pressure consistently. And then one other modification you can make with that, we call this like a slump test or a slump nerve glide. Again, you can put your arms back behind your back, slouch your low back, but then you can keep your head up. As if that doesn't seem to bother your neck, you can then, again, you can either do the gas pedal or you can pull your toes up, but since my head is up, I've now taken away some of that tension of the nervous system down the back of my entire body. So then you can just go through about 5 to 10 times for any of these nerve glides, and most people generally feel good pain relief after they do them, as long as you're not pushing into pain while you do them. So I usually will tell people to perform 5 to 10 of them throughout the day. Again, as long as they don't hurt, as long as they don't increase your symptoms, and you can do them anywhere from 5 to 10 times a day. Because usually, like I said, usually people do have some good relief when they do them. And that's about it. So that's today's session on nerve glides. Have a good day.